Hello everyone! I am Dodivic Villena Arma, a physical therapy intern from RTRMF, and this video covers the proper execution and interpretation of the Romberg Test as an outcome measure tool. Let's get started. The purpose of Romberg Test as a form of evaluation which is administered by any trained professional is to identify a particular impairment in patients with specific proprioception difficulties for purposes of intervention and improving patient outcomes. It removes the visual and vestibular components that contribute to maintaining balance and can thus identify specifically a proprioception-related neurologic disease. Furthermore, the Romberg Test is a simple bedside test that should be performed on all patients presenting with imbalance, dizziness, and falls. The current literature in similar way demonstrates safety in performing this test under the supervision of a professional and following the correct procedure. Moving on, there are no additional medical equipment necessary for this test. But remember that only a trained medical professional should perform this test in a safe environment. The examiners may perform this maneuver alone and without the assistance of another trained professional, provided that he or she should stand close to the patient out of caution in case of loss of balance or falling during the test to prevent any type of injury. Then, to begin the evaluation, the patient is asked to remove the shoes and to stand with both feet together. Next, the examiner instructs the patient to hold his or her arms next to the body or crossed in front of the body. The first stage of the test involves asking the patient to keep their eyes open while the examiner assesses the patient's body movement relative to balance. The second stage involves instructing the patient to stand erect with their eyes closed while the examiner notes any balance impairment for a duration of 1 minute. Swaying of the body may be observed. However, this indicates the proprioceptive correction of balance for the lack of visual or vestibular compensation available. The Romberg test is positive when the patient has a loss of balance with their eyes closed. Loss of balance can be defined as the increased swaying of the body, foot movement in the direction of the fall, or falling. And a positive Romberg test denotes sensory ataxia as the cause of postural imbalance. That's it. Thank you so much for watching and I hope that you've learned something today. See you again on my next video.